Hi everyone, thanks for joining. We're going to get started now. 30 minutes, one question, one follow-up. And we have Dr. Yaffe and Dr. Huyer here today, so I'll turn it over to Dr. Yaffe for some brief remarks.
Thank you very much. Good afternoon, everybody. Today we're reporting an increase of 538 new cases, with the majority occurring in the Greater Toronto Area and Ottawa. While 60% of the cases are in people under the age of 40, the case growth is now occurring in all other age groups. And on this day being National Seniors Day, I want to acknowledge the tremendous contributions that seniors have made to this province and the society we live in. And I also want to take this opportunity to remind everybody that older adults are at higher risk of serious complications from COVID-19. So, as we celebrate the older adults in our lives today, please remember we must all do our part to lower the risk of transmission to others, including older adults, by consistently following public health measures. I also wanted to provide you with an update regarding changes to the COVID-19 school screening tool and to provide additional guidance about when it is most appropriate for individuals to seek a test for COVID-19. For students and children, the screening tool now has two sets of questions about symptoms, which may result in different steps depending on which symptoms are selected. The first set of questions asks about symptoms such as fever or persistent cough. Students and children with these symptoms or any of the symptoms in that list will still be advised to stay home until they are able to consult with a healthcare provider and receive an alternative diagnosis or a negative COVID-19 test. The second set of questions asks about other symptoms that are commonly associated with many other illnesses, such as a runny nose or a headache. Students and children with only one of these symptoms will be advised to stay home for 24 hours, after which they can return to school if their symptoms are improving. Students and children with two or more of these symptoms will be advised to stay home until they're able to consult with a healthcare provider and receive an alternative diagnosis or a negative COVID test. In addition, we note that the symptom list no longer includes abdominal pain or conjunctivitis, otherwise known as pink eye. These changes were based on a review of the current evidence and in consultation with pediatric infectious disease experts. This will ensure that our children are able to attend school or childcare as much as possible while minimizing the risk of COVID-19 transmission. We know that the demand for testing continues to remain high. Yesterday, we processed almost 40,000 tests, with over 80,000 still pending. That is why I'm reminding everyone, please only go to get a test if you need one. And you should only seek testing at an assessment center if you are showing symptoms of COVID-19, you've been exposed to a confirmed case as informed by your health unit or exposure notification through the COVID Alert app, or you're someone or a resident who works or lives in a setting that has a COVID-19 outbreak as identified and informed by your local health unit. Eligible for testing as part of a targeted testing initiative directed by the Ministry of Health or Ministry of Long-Term Care. So those are the groups that should be going for testing. The most important one is if you have symptoms. If you have no symptoms, you haven't been identified as a contact or part of an outbreak, do not get tested. So with that, I'm going to turn it over to Dr. Huyer for some information on the trends we're seeing.
Thanks, Dr. Yaffe. It's always a pleasure to be here with you and with everybody else. So just a couple of things to build off the education guidance that Dr. Yaffe and I have had conversations on over the past number of days. I think the key point that Dr. Yaffe made that I wanted to reiterate is Some children have ongoing health problems, so they may have allergies or they may have some other challenges with their respiratory system, and it's really if there's new or worsening symptoms. Those are key things to remember. So looking at the baseline, and parents know their child best, their family doctors know their child best, and so they'll know whether these are changes in their symptoms. So that's a key point. And the other thing is, it's not just to go get testing, and that seems to have been some messaging that's occurred from a variety of ways and a variety of sources. Just going to get tested, again, the test is only a point in time, and if they don't have symptoms, if someone doesn't have symptoms or there's no exposure, there's no suggestion, and frankly, the test won't likely be helpful at that particular situation. And that's consistent with or not consistent, completely matches with the guidance that was released last Thursday, which is testing should be done for those who have symptoms, those who are true contacts and of somebody who is positive, and in outbreak situations, because we need to ensure that testing capacity is available to stamp down those outbreaks when they are present, assess where there is true risk, like long-term care homes, and especially reflecting on what Dr. Yaffe said about it being Seniors' Day, thinking and remembering, and really focusing our attention on protecting those who may be more vulnerable. So speaking a little bit about outbreaks, which is the area that I focus on a regular basis, over the past 7 days, we have identified across the province about 108 outbreaks have been identified through the mechanisms that we have to track and understand. That is representative of fits within the 178 within 14 days, and that is compared to the previous 2 weeks, which was 75. So what do all those numbers mean? The numbers mean that each day as we move forward, we're seeing more and more outbreaks. So increasing number and increasing range of outbreaks with notable observation of those in the vulnerable sector. So we're seeing those in long-term care homes, retirement homes, as Dr. Yaffe said, and other vulnerable sectors. And those are the areas that we want who are most at risk and most vulnerable to the infection, as we saw in the initial phase of the illness. So clearly an important thing to recognize and to watch for, and to do our best to try to address those. There are key areas that have the highest numbers. Dr. Yaffe commented on Toronto, Ottawa, Peel, and the Greater Toronto area within there. And what we've seen is an increasing number of outbreaks in a variety of settings. For example, in Toronto, if we looked between September 20th and 30th, they had 49 outbreaks. Of those, 19 or 39% were in bars or restaurants. And when drilling down into those numbers a little bit more to help understand what happens in bars and restaurants, there is a range of both patrons and staff. It varies from outbreak to outbreak, the percentage of those, but we are seeing about 15% of those who work in those facilities in Toronto, as I understand from Toronto Public Health, 15% of those work in more than one service industry. So they may work in two different restaurants, or they may work in a restaurant and then retail. And so there is that intersection and that crossing across into the different settings. About 20% of those working in those organizations socialize after with each other. And we've also seen a percentage where public health measures were not effectively applied in those particular settings. So those are all concerns and some examples of challenges that we're seeing within the group that is most notable, the younger population, where about 67% of all cases are below age 40. I think that gives you a view of what's occurring from the outbreaks. Again, the number and the range of those is very challenging, and it's not one or two in different places that we're trying to circle around and draw to a close with the public health approach and investigation. It's much more, and it continues to be more and more reflective of greater concern and similar to what we see with the numbers. Thank you.
So if I could just add to Dr. Huyer's summary, We're also seeing from our health units that the number of contacts per case is much higher than it was in the first wave. And so this increases the complexity of the case contact and outbreak investigations quite a lot. And it's clear really that people have let their guard down when it comes to following basic public health measures. We continue to ask everyone to please commit to following the basic measures. Keep yourself and those around you safe. Wear a mask, stay home when you're sick, wash your hands, keep your distance. So with that, I'll turn it over for questions. Thank you.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
First question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, doctors. Thanks for taking our questions today. On the new guidance, it says that if children have those top 4 symptoms, that they should contact their healthcare providers for further assessment, including if your child needs a COVID-19 test or not. I mean, there's reference in this to a negative test not required to return if you have one of those other symptoms. But I know it's probably dependent on the daycare school's own policy, but I'm wondering why a COVID test is not automatically required by the province if children have one of those top 4 symptoms that you've laid out.
Well, those symptoms can be part of a picture of other illnesses or other conditions that the individual child or student has. They may have an ear infection. They may have a strep throat. They may have cough, whooping cough. There's lots of other things that they might have. So it's important, first of all, the parent knows the child the best. And then after that, it's their primary health care provider. So they would be able to hopefully assess the child and say, I think this is an ear infection. This child has had ear infections. It's another ear infection. You need whatever treatment, and you're going to be fine, go back to school. If in that assessment they say, no, this is really unusual, this child hasn't had any of these issues, and we're concerned it could be COVID, then they should go for a test on the advice of their healthcare provider. Just doing a test on its own is not going to necessarily help the situation. It may be negative. If it's positive, okay. Right now, particularly, we're really hoping people go to get a test if it's really required.
And hi, Laura. It's Dirk Huyer. Nice to hear from you. Just to build on that, if we think about what we do generally in medicine and healthcare, the healthcare provider and the parent and the child work together, depending on the age of the child, to figure out what's going on. Like, it wouldn't be that somebody would go and get some other test. They wouldn't go just to get a test for something at the hospital or at the lab without having a perspective of the healthcare provider, the parent, and the child. And this is no different. As Dr. Yaffe said, there are a number of things that can cause fever and chills, and there should be an evaluation. And the 3 working together will allow not only the assessment, but to ensure the management of the person. Just going to get a test doesn't allow that continued involvement of the healthcare provider and the parent.
Follow-up?
But isn't this exactly what's happening? Parents are seeing these symptoms in their children and taking them for a COVID test because they need the test to go back to daycare or whatnot. So are you telling parents they don't need to do that anymore? They should consult their doctor first? And what are you telling daycare providers about requiring a COVID-19 test in order to return their child to the daycare?
Well, you're right. We have been seeing that, and we are changing the policy or clarifying that schools and daycare should not be requiring a negative COVID test. In fact, they shouldn't even require a doctor's note. The parent knows the child the best. If the parent has consulted the provider, the child is feeling better, they should be able to go back to school.
Every day we learn more about this disease, and every day we learn more about how to manage and treat and how to work together in the most effective way to enhance the health and safety of everybody. This is always thinking about how do we do better each day and how do we work together to provide the best health advice and health intervention.
Next question.
Next question comes from Chris Herholt from CP24. Please go ahead.
Good afternoon, doctors. Given the backlog of test specimens awaiting processing has reached 82,000, and Minister Elliott said today that specimens become unusable 3 days after collection, can you guarantee that every specimen in possession right now will be processed before it becomes unusable?
Hey, hi, Chris. It's Dirk Huyer. Thanks for that question. You're raising a very, very important point, and I'm not in a position to answer it from a perspective of a guarantee. I can tell you that I don't have direct involvement with the lab, but I've been involved in many of the conversations over the past number of days and participating in hearing about them. All steps are being taken to do the testing as quickly as possible and as effectively and efficiently as possible to do all that can be done to get those tests completed in the most timely way.
But I mean, that is why one of the reasons we're saying don't go get a test if you don't need it, because you will just add to the backlog. It's very important that the test is done in a timely fashion so that not only the individual knows their result, but their contacts can be identified and contacted quickly before they develop symptoms, hopefully, and before they infect others.
Follow-up?
On a different matter regarding the Abbott rapid test approved by Health Canada yesterday, could you have any timeline or plan on where or when or how many kits Ontario could get its hands on and where they would be deployed?
And this is an area that the lab network and those in charge and working with the lab network and organizing the testing are best answered to. So unfortunately, I don't have that answer for you. I can tell you, though, absolutely that this is a very live and ongoing conversation, and I believe there are a number of meetings occurring on an ongoing basis, including today, to be able to answer that question, Chris.
Next question.
Next question comes from Randy Rath from Stage TV. Please go ahead.
Hello. I have a very simple question today. It's the season when snowbirds start to think about going south for the winter, and I'm wondering, should people simply refrain from going to southern locations in the United States this year?
Well, that's a new question for me. I think that they should make sure that they're fully informed about where it is they're going and what the rates of COVID are in that location. I know certainly a lot of people who have places in Florida. They have decided not to go. At the end of the day, it's a personal decision, but they are in a high-risk group, and they would have to know the situation that they're going into.
I think it really speaks to how everybody should be considering everything that we're all doing. We have to think about a risk that we're putting ourselves potentially entering into. So we have to think about where are we going and what are we going into? What is the risk that we might have? And Dr. Yaffe talked about the percentage of cases or the positivity or the infection that may be present within a setting that you enter into, and then could you be potentially bringing that into the setting? So things about what are you going to do, and thinking about, is it a wise thing or what is the risk of them entering into it? And then when you enter into that setting, you need to take the proper precautions to ensure that you're protecting yourself and protecting others for potential transmission. And so all of those things, Dr. Yaffe talked about the physical distancing, the hand washing, all of the care that needs to be taken to ensure that you're not placing yourself into risk, are key things that need to be thought about on an ongoing basis. One of the other things that has been touched on is also the number of contacts is shown to us. What we believe is that there's many more people intersecting with people on a regular basis. In contrast to July and August, where there have been 5 contacts, we're now seeing 25 to 30 to 40 at different times from cases. That clearly means that people are intersecting more frequently. And so if we can think about minimizing any physical interaction to the lowest number that's necessary. Clearly, people need to intersect in different places, but thinking about the lowest number that would be required to intersect with, if there is intersecting, thinking about that risk, and if there is risk, minimizing the chance of potential intersection.
Follow-up?
Now, to get down into the southern states, it seems that it is possible to drive your car across the border if you own property, have a residence down there. If people think that car travel is safer than flying, is car travel safer than flying in the current atmosphere?
I think, it's very, one of the biggest causes of mortality and issues with travelers is motor vehicle crashes. So I'm not sure that I would say cars or driving a car all the way down there would be safer than a flight. The flights, I know that they've put in a lot of precautions and people are required to wear masks. I guess another factor that needs to be considered is if they do go down to the States, unless the conditions change, when they return, they will be required to undergo quarantine for 14 days. So I think there are just a lot of factors. They have to make sure they're fully informed on the risks and potential benefits if they're going to do that.
Including the availability of health care, and those are other things that must be considered at any time with that travel.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, doctors. Just wanted to follow up on Laura's question, and particularly your response, Dr. Yaffe, about notes and negative COVID tests not being required for students to come back to school or childcare. I think this is a bit surprising. This is the first time I'd heard that. Is there a greater effort that's needed on the part of the government to issue directives to schools and to childcare centers to ensure that that is actually being followed?
Well, we're working very closely with the Ministry of Education and the other ministries that deal with childcare to ensure that the information is shared. In fact, Dr. Huyer and I were on a call earlier today with directors of education. So it will take a while for this information to get out, and we're also working with the local medical officers of health to make sure that information is available locally. And yes, we'll have to just keep getting that message out to people.
And Sean, you being here and the others being here is going to help with that, helping to disseminate that information using all avenues to share and for people to help to understand that these are not requirements. There's a number of different phone calls and different meetings that Dr. Yaffe and I have been on stating this exact information. So yes, you helping. It's great that you're here to help to share that information because it's very important, and it's challenging for families, for care providers, for schools to have to navigate all of those things that frankly are not part of the guidance.
Follow up.
Specifically about the changes to the symptoms list. I'm wondering why runny nose and headache remain on the list at all when British Columbia took those symptoms and others off the list as well. So why are they here remaining on the list in Ontario?
We certainly did look at the British Columbia list and in fact spoke to staff there about the rationale behind what they did. And we then consulted with Public Health Ontario. They looked at the data on cases of COVID-19 in children in Ontario and which symptoms those children had. And I have never discussed runny nose so much in my life, I have to tell you. Up to 17% of children with COVID-19 in Ontario only had a runny nose when they started. So we felt we had to include runny nose. However, we know that runny nose is a very common symptom, and in the vast majority of cases, it is not COVID-19. There's all sorts of other causes. There's other viruses, circulating in the community. The kid might have just been outside and got a runny nose. So we want to. That's why it's still there, but we're looking at really, is it a significant symptom, and do they have other symptoms as well? If they only have a runny nose, they go home, it gets better, they have no other symptoms, they can go right back to school the next day.
It was As Dr. Yaffe said, and I was watching Dr. Yaffe do all of this work over the period of time to think about them, consulting with other medical experts as well, Public Health Ontario, Dr. Yaffe, other clinicians. This is the best evidence that's Ontario-driven, and there are differences with this virus in different settings. So need to be thoughtful, need to be careful, need to provide the best possible advice, and it may change, but this is the approach that was taken.
We continue to learn about this virus, and as we learn, we modify how we do things to the best of our knowledge.
Next question, and this will be the last question.
Last question comes from Alison Martel from Reuters. Please go ahead.
Thank you. How is the test backlog and extending turnaround times affecting contact tracing in Ontario?
Well, it is definitely affecting it in a negative way. I don't have the particular statistics, but obviously, if the case becomes ill, there's always a bit of time before they actually go for the test. Then there's the turnaround time, which we are aiming for 24 to 48 hours max. If it's longer than that, by the time the health department gets the report and then interviews the case, finds out where they had been while they were infectious. We're going back quite a few days now, and by the time they then reach those contacts, unfortunately, those contacts could already be incubating, could in fact be symptomatic, could have spread it already. So it's very important that we reduce the turnaround time and make sure only people who need it get tested.
Hi, Alison. The crucial message that Dr. Yaffe is providing. Dr. Yaffe was another extremely esteemed physician, but Dr. Yaffe really makes a strong point, and you illustrated it, Alison. This is my area where I'm focusing and working with the public health physicians across Ontario. Outbreaks need to be managed as quickly as possible to control those and circle those down. And when the turnaround time is increased, it clearly affects us contact tracing. So this is fundamental to supporting the revised and informed testing strategy and the guidance that's resulting from the change that Dr. Yaffe has illustrated today.
Follow up, and this is the last question.
Thanks. Just to go back to the issue of screening at daycare and school, if a child with a cough and a fever is allowed to return without a negative COVID test or a doctor's note, what is it that stops COVID from entering and spreading within that facility?
So if they answered yes to those symptoms, which are in the first category, we're saying the child should stay home, isolate immediately, contact your child's healthcare provider, family doc, pediatrician, nurse practitioner, for further advice or assessment, including if the child needs a COVID test or other treatment. So if it could be that, as I said earlier, the physician may say, your child has another ear infection and needs to go on antibiotics or whatever, and once the fever's gone, can go back to school. It may be that the physician says, you should have a COVID test, and we need to have a negative test before you can go back to school. It will depend a lot on that assessment. I think it's important also for context that at least 20% of cases of COVID-19 in children are totally asymptomatic. That is, they have no symptoms. So, and in fact, that's the BC approach is more that they are basically saying, we know we cannot keep COVID completely out of the schools, so why are we looking for all these symptoms? So we are saying, no, we want to find it if it's there, if we can. We cannot find every single case, but we want to find those who have symptoms and keep them out and make sure contacts are followed up.
And building from that, that's exactly why there's a multi-step process in place with children being screened when they're at home and don't leave home if you've got symptoms. Then when you get to school, there's a single point of entry where there's screening that's done in a very thoughtful way, in a very thorough way by the school personnel. And then when they come in, they've got things to prevent potential transmission by the physical distancing, if possible, with masking, with hand washing, all of the proper steps, and kept together within a smaller group and lists in place. And if there is a positive case, then they will be able to have a smaller number of people to investigate and to evaluate and to reduce the potential. So all of those things are important for exactly what Dr. Yaffe says. There may be cases that will get into the school, but all of the steps need to be taken, and people need to maintain all of those very important prevention for transmission steps to ensure that if there is one that does come in, then that is minimized for any transmission.
I just want to make a last comment here, which is to remember the school is part of the community. So if we can reduce COVID in the community, we will reduce COVID in the schools. So it's up to all of us to do that.
Thanks, everyone.